Hello and welcome back to my channel. My name is Lucy, and in today's video series I wanted to incorporate my passion, which that is makeup, and also how I got into it, and also how I do it primarily just with one hand, because I was diagnosed with dystonia. Some of my friends would ask me like, oh my god, like how is it that you do makeup one-handed? But then I would say kind of like, you do it, because like you use your brushes just with one hand. But then I realized that, you know what, maybe that's true, but at the end of the day, makeup served as more than just like feeling better about myself or self-confidence. No, instead, for my own journey, it served as a therapy, and also it served as a way to create some like art therapy. So yes, I just wanted to go ahead in today's video and speak more about that and how it helped me and how I have progressed my dystonia as well as my makeup skills. So let's go ahead and get started. Also, as you guys may or may not notice, I have a bruise here, and that's because I got the Botox injections quite a few days ago. So the bruise is still gonna be there, and then also here. That's for my muscles, contractions, and spasms that I do get from the dystonia. So on an everyday basis, my friends will literally tell you they just see me like this barefaced, natural, with all of this going on. Since when I go to work, which I work from 5 a.m. up until 1:30 p.m., I don't want to be putting all of this makeup on my face, because if you know me, you know how much I appreciate my sleep. So the things that I do for work is primarily getting my eyebrows done, my either mascara, or I do a little bit of eyeliner, a little bit of lipstick, and also a little bit of blush, because since it's kind of like a medical setting, we have to wear face masks too. So that is why I don't do the entire makeup look. So first things first, I'm gonna start up with my Makeup Forever Step 1 Skin Equalizer, and this is the smoothing primer, and I love this one because this one really gets rid of all of your pores, even the non-existent ones. I apply where I have most of my pores, which is in the T-zone, so like here, a little bit here, and here, and then I just go ahead and blend that outward onto the rest of my face. That way everything is primed and good to go. So next up, I'm gonna go ahead and grab my two foundations, which I like to mix just because there is not really an in-between shade that fits me. But if there is, please let me know. So I'm just gonna go ahead and mix just a tiny little drop of each one. That way I don't get too much of that full-on coverage, because I don't really like that. But like for instance, for any events or anything like that, I go full in. But since today is just gonna be kind of like a natural-esque everyday kind of look, that's why I'm going in with a little bit less makeup than I would naturally do for events, for fancy events, or anything like that. So I had some technical difficulties, so I apologize if anything looks different. So whenever I was in primary school in Guatemala, I hardly did any makeup that I could remember. If anything, I did some mascara as well as some eyeliner and a little bit of lipstick, but that was it for me. I wasn't really into that much applying of makeup, because then again, I really like my sleep. I really enjoy my sleep. But whenever I got diagnosed with dystonia, nothing really changed. I mean, aside from my entire life, but regarding the makeup. So whenever I was in Guatemala, I used to play squash, dance, tap, and jazz. I used to swim. I used to be quite athletic. And I would have some things to do, throughout my free time. But moving to the United States, seeking better medical treatment, I was like, well, what do I do now? Mom, Dad, entertain me, because I don't know what else to do, I would just go ahead and start playing with makeup. So I'm gonna go ahead and grab my Charlotte Tilbury Beautiful Skin Sun Kiss Glow Bronzer. Who says... My goodness, say that 5 times fast. So anyway, there was a point where we went to live with my grandma in California, and like I was not doing really much anything. So I had so much free time, and I mean, at that point, I think that it was in June, July or so, so there was no school for me to start. But also at this point, I didn't know that I was going to be actually living here in the United States. I thought that, like, okay, I'm gonna be getting some medical treatment and then going back, or even if needed, I would be back and forth, for my medical treatment. I didn't think that I was going to be pretty much like leaving my family, my hometown, my school, my friends, So of course there was a point in my life where I became quite sad, but that comes, it's normal because, it's something that I was diagnosed with and that I didn't know like anybody else who had it, or like I hadn't heard anything about it or anything like that. So like as common as it is not common. There is not much awareness of dystonia because it comes in so many different cases, as well as, like, for instance, I met one of the girls at New York when I went there, and she was diagnosed with the same hemidystonia as me. I think that hers was on the left side of her body, and hers was, I believe it was caused by a mosquito bite, so like a virus. But her foot, instead of like twisting inwards, it would go kind of like a ballerina, so like she would trip and fall. So anyway, when I was in California, I wasn't doing the things that I used to love, so I went ahead and I started playing with makeup, and then I started watching some YouTube videos with makeup. So, and like whenever I would do makeup, I would feel kind of like free, kind of like I'm capable of doing something on my own, and like the time would pass by so fast that it was kind of like, oh wait, it's already like what, 6 p.m. Oh my god, great, because like you get into it. Sorry, that's whiskey, my dog. So yeah, after then I started doing my own makeup, as well as my friends' makeup too, and then that, got the ball rolling. And then I started to do makeup for weddings, for events, for engagements, and yeah, and I love that. And then there was a point where I had to stop doing makeup for other people because that would cause me stress and anxiety. Even though the type of stress that caused me was good stress, I had developed very bad chronic pain up in my shoulder. So that's why I stopped doing it. And for that, I had to get the deep brain stimulation surgery. And I'm not saying that just doing the makeup for other people was a cause for my chronic pain. No. That's not what I'm trying to get at here. What I'm trying to say is that that probably was one of the many factors. Having your muscles contract and spasm involuntarily, it is really painful, to a point that like you cannot continue doing anything throughout your day just because of the pain. And I stopped doing makeup for a while. I got my brain surgery, which I'm planning on doing a makeup more in depth regarding the deep brain stimulation surgery that I had. How I can do things without getting that much pain, at least. Of course, whenever stressful situations arise, I might be getting a little bit of pain, or whenever there's more reaction from my muscles, contracting and spasming involuntarily, I do get pain here and there, but it's nothing compared to before getting the deep brain stimulation surgery, for which I am so very thankful that I got it, because otherwise my overall life I wouldn't be able to even be working right now, which I work at a substance use disorder clinic, and I love working there. I love seeing patients succeed, and sometimes it might be a roller coaster from there, but it reminds me of my own roller coasters, and I can empathize. And so I'm just gonna apply it to my cheeks and a little bit on my nose. So for the application of the soft glow enhancer complexion, I'm just gonna go ahead and use my fingers. Sometimes the fingers can help the products emulsify a little bit better on your skin. So it means that I don't have to go ahead and use another brush. That means that I don't have to go ahead and deep clean my brushes as often, or even more brushes, because cleaning them, at least deep cleaning them with one hand, is quite an eventful situation. Brush them upwards and outwards. So I'm just creating some hair-like strokes. That way it's not like an entire sharpied up brow, which I mean, if that's your thing, that is your thing. For today, I'm just gonna go ahead and grab my same Charlotte Tilbury Beautiful Skin Sun Kiss Glow bronzer. That way it all looks cohesive, and I'm just gonna go ahead and start blending that out and up just to create their natural shadow. Fun fact, eyeshadow was one of my favorite things to do at one point, because you know, it was like the colors of it that would get me excited and passionate about makeup. But nowadays I feel like it's a little bit of both, but I have definitely swayed into the facial makeup. Whenever I used to do mascara on clients, like, I would get really nervous at first, because you know, mascara is like, it can get into their eyeballs really fast. So I would just tell them to look opposite as to where my mascara was going to. So for the bottom lashes, I like to use any waterproof mascara just in the event that, you know, like I start sweating, and because these ones tend to touch whenever I smile, and I do smile quite a lot, with of course our mouth hanging open. That way, instead of like being just like this, that creates like that puffiness here, but if you open up your mouth, that extends. A lip balm, I believe it's in the shade Rose. That way we can stay as hydrated as possible, but it also provides you with a little bit of color too. A little bit of nice coloring on the lips. So that's it for this video. I hope you guys enjoyed, and if you have any questions, comments, or concerns, please don't hesitate to reach out via the comments and whatnot. Okay, I hope you all have a good day. Bye now.